Hi everyone, I'm Shaza Attar, board certified behavior analyst and founder of Autism Therapy and Training. So I get a question a lot, is ABA treatment the right treatment for my child? Should I be putting them in an autism center if they're diagnosed with autism or we're suspecting autism? So the question again, is ABA right for my child? The answer to that is really everybody uses ABA. ABA is a science based on principles and procedures such as reinforcement, punishment, shaping, and chaining. So if you think about it, teachers, doctors, businesses, everybody, even yourself, you're using applied behavior analysis. So you reward your child. You may put your child in timeout. If you have your child in swimming classes, maybe they're using a shaping type procedure. If you're teaching your child to ride a bike, you're using a chaining procedure. So realistically, we all use applied behavior analysis. So we know that it works. We know it's a great science. And, I think the question that you really want to be asking yourself is, what is the right environment for my child? And is an ABA treatment center or that kind of environment, is that the right environment for my child? And so that's when you can ask yourself, is my child able to, participate and, sit with other kids or play with other kids? Are they verbal? Do they need to learn certain skills one-on-one? And, what made you, for example, contact an autism center to begin with? So, obviously maybe your child has been recently diagnosed with autism, and that's probably why you called an autism center. Sometimes we get parents that don't have a diagnosis, but they, have their child has a speech delay, or there's some behavioral challenges that they're experiencing, or something just doesn't, feel right. And so they've contacted an autism center or an ABA, center because someone has recommended that kind of treatment for them. So the science, ABA, is something that everybody uses. The teachers use it in school. Everybody uses it. But the question is, should you be enrolling your child into an autism center? So to kind of answer that very briefly, obviously there's so many factors and there's so many things to consider. If your child is diagnosed with autism and they are not really responding to their environment, so they're more isolated, they don't really play with others, not a lot of language, maybe there's a lot of behaviors that you're dealing with at home, that might really get you to lean towards an autism center because you want to give your child those one-on-one, teaching opportunities so that you can really develop those skills as quickly as possible. Remember, putting your child into any kind of one-on-one environment is not a forever kind of treatment. I mean, a lot of children get tutors to tutor them in math and, English or whatever it is, reading, writing, whatever it may be. They get tutors. So that's a one-on-one environment as well. And we get a tutor for, a child because sometimes we find that they're not really picking up those skills or they need extra help. And so when you're enrolling your child into an autism center or that kind of environment, you're really thinking about, my child needs a little bit of extra help, and this is what I'm going to give them in this, it might be 6 months, it might be 1 year, it might be 3 years. So it really depends. Every child is different. If your child is in school and they are, doing just fine. So let's just say your child is 5 and you have them in school and everything seems to be fine, then, you may not really consider a one-on-one environment. The only time that you consider those one-on-one environments is when you're starting to see that your child is not picking up certain skills and they're not meeting that milestone, for example. And so what we don't want is children to fall behind, and we want to give them that opportunity to learn that skill, and sometimes they just need it one-on-one. When they're working, for example, with one of our therapists here at the center, we set specific goals. So we assess the area of development, and then we take a look at, okay, for example, they should be reading, but they haven't even identified letters yet. So we really need to work on identifying letters and sounds of letters and, being able to build up those skills to get to reading. So again, every child is very different. What you need to ask yourself is, what made you reach out to, an ABA facility or a treatment center, and what do you think your child is going to benefit, or what do you want them to benefit in the time that they are there? And I think it's really important for you to set those goals with your treatment team. So really talk to them about your concerns, what you would like your child to have by the end of, those 3 months or 6 months. And when you enroll your child into, let's say, an autism center, they would be doing an assessment maybe every 3 to 6 months. So it's really important to talk to your treatment team about what goals they are setting and what goals you want your child to be working on, because those are really important. They'll obviously guide you and coach you, because sometimes parents will say to me, I want my child to answer WH questions, but they're still not able to ask for, simpler requests, or they only have, one word sentences. So we really want to be able to build those phrases and build the ability to answer questions and so on before we jump to their ability to answer WH questions, because we need them to have that vocabulary and the content before they go into something a little bit more complex. So I hope this was helpful, and I hope the next time that you are thinking about what environment is right for your child is to really look at their skills, speak to, the professionals that are working with your child, whether it's the teacher, the speech pathologist, the behavior analyst on the team. And of course, your child best, so you'll know if your child is not able to join other peers and play with others. Of course, exposing them to that environment is really important, but at the same time, not every child is going to be able to pick things up naturally and spontaneously, so they just need that extra help, and that's what we're here for.